Hello everyone, so this is a case for a double jaw edentulous patient that will undergo implant placement and immediate loading. If loading will not be needed, then the patient will go on spare dentures that are exact replica of these pre-drilled conversion prosthetics. So the sequence for this case goes as follows. The first thing is the maxillary jaw. The case must be started with the maxillary jaw. The full maxilla have to be flapped buccally all the way. The more you flap those cases, the more you spend less time in seating the base guide and go with the procedure accurately. So the first thing is to flap the maxilla as we mentioned, and then you have the bone reduction guide and you have the index. The index is an exact replica of the patient existing denture. So since you flap the maxillary jaw, you go seat the patient existing lower denture in position, and you see those big bone leg. You go get this complex, seat it on the patient native bone, and ask the patient to bite into her duplicate existing denture, this one, and then you pin your base guide. And once you pin your base guide, then this will stay fixed to the maxilla, and you can start with bone reduction, which is this level of bone reduction. The bone reduction for this case is literally minimal. You shall be having the reduced form of the bone, so you know exactly what you are looking for. And then once you're done, you go get your implant placement guide. You see these screws. These screws might interfere with the palatal tissues, okay? It depends on your reflection of the palatal tissues. So if you find difficulty in seating, just using a disc, cut those supports. They will just give you support for the whole complex, but it's no big deal if you remove them. Then you go seat your implants into position. Once your implants are seated, you adjust the timing on the implant placement guide. One more tip. You can see here the timing marks exactly replicated on the base guide. Though they will help you if you want to manually fine-tune things, and also they will guide you on the screw where you will use your screwdriver to place your multi-units. And these are the black marks that guide the screw, okay? Since you placed your temporary cylinders now, all you have to do is you have two maxillary conversion prosthetics, and you have two carriers, one with the supports and one without the X support. This X support might interfere with the palatal tissues, so we gave you two. Just feel free whatever you want to use. And all you have to do is you seat it into position. You seat it antero-posteriorly, okay? And there you go. And if you want to secure it, I would add flowable composite here and flowable composite here, cure them, so it helps me. And when you take it out after conversion, all you gotta do is section attachments and then slice it into little pieces and tease your prosthesis out, okay? And then you go seat it into position, okay? Let's imagine this is the surgery, okay? So now you have your bone reduction into position. All you gotta do is wiggle it and get it into position. And then you don't have to ask the patient anything. You can convert through these holes, the buccal holes. Just stick the pro temp gun and convert your case. Make sure you put Teflon so you don't get stuck. And now you have completed the maxillary jaw. When we go to the mandibular jaw will undergo the same procedure, okay? And you have the index of the new prosthesis of this one, okay? Because this one will seat to the setup that we have already converted, okay? So you go get the complex into position, and then you go seat it into bone, and you ask the patient to bite using the one that we converted with our new prosthetic, okay? You ask the patient to bite, and once the patient has bit in the correct occlusion, you pin the lower base guide, and then voila, you're done. And you go on with your bone reduction. Okay, same protocol. You go out with implant placement and multi-units. And this is the implant placement guide. You see the timing that you have on the angled multi-unit implants. And look at this. So this, you see green and black. Black indicates where your screw is gonna go. On the other side, you don't see a black because the screw will go distally. It's just like angle to the angle of the mandible, okay? And then you go place your temporary cylinders, and you go ahead, and you have two prosthetics, and you also one with the X, two carriers, one with the X and one without. Feel free to use whatever you want, okay? We seat it anterior posteriorly. Okay, now it's seated. If you want to secure it, you can. And then voila, all you have to do is you just, this is the surgery. You attach your temporary cylinders, you put rubber dam, you put Teflon, and then voila, you go and seat it. And you convert through the buccal holes. Make sure the patient bites into those indentations. And you have a great day.